Yat kudoda ni hinathligi da is not agishik a nothini she ya Niagara Rockbridge agin she ki ani na slash gan to hobash china kadina e da should chet holchana e da shanale she ya the never a ken shle kodo e ya sheet o ya nanat e do he het ni dini do les kodo dan hinathligi do da is not agi Kodoshi e yaha Navajo Cancer Prevention Program Rolanda Todecheenie Woliego Shin Kodo Cervical Cancer Awareness Do Prevention Olieheki Asian Kodo Niche Ohoto Atlako Kodoshi e ya Abulaganik Echiko Niche Hadest. Hello, my relatives from across the great Navajo Nation. Thank you for tuning in to watch this presentation on cervical cancer awareness and prevention. This will be done in partnership with the Navajo Cancer Prevention Program, Rolanda Todecheenie, and she will be giving a presentation in English and also in Navajo. So following the concluding of the English presentation, there will be a Navajo translation of the same presentation. I encourage you to share this with your family members, your relatives, and things of that nature. I do want to make a note that there is a disclaimer that there are some sensitive content within this presentation, so the viewer discretion is advised, but I would like you to go ahead and watch this presentation on this educational series so that you're able to be well informed for ourselves as women and also for men as well. And we did have the first of the 2-day series for the breast cancer that did air previously before this cervical cancer. So that is still available here on the Office of Miss Navajo Nation's Facebook page and also on the YouTube page as well. This presentation will also be available on the Facebook page and YouTube page of the Office of Miss Navajo Nation. So with that, and without further ado, I give the floor over to Miss Rolanda Todecheenie.
My name is Rolanda Todecheenie. Chanja kina ainge na kabahay bashishin. Kachitni dashache do Todecheenie dashanala. I will be presenting on cervical cancer awareness, and I work with Navajo Nation Breast and Cervical Cancer Prevention Program. I'm a case management specialist in the Chinle Service Unit area, Women's Health Program. So we'll go ahead and get started with our presentation today. When we do talk about cancer, it's not going to cause, just because you speak of it, it's not going to cause cancer, or it's not going to bring it into your communities. And it's very important to learn how we can protect our community and ourselves from cancer. Those are some of the things that we'll be talking about today. And it's an important way to support those that have cancer so they don't feel isolated or alone amongst other individuals, family members, or loved ones who don't have cancer. One thing that I wanted to bring forth this early into my presentation is the Navajo terminology that we're currently utilizing, because I'll be utilizing this term, Navajo terminology. I'll be utilizing this as well a lot through one of my other presentations. So I wanted to make it known that this is the Navajo terminology that our program under the Navajo Cancer Prevention Program is utilizing. So just the two words there in itself, cervical and cancer. The term that we're utilizing to translate in Navajo is Atzis Betlor Datense Adobat Hadloi Leheki Asana Bish et Belakaki Din Se. So Atzis Betlor is the human body cell. Datense, meaning that it develops and it grows. Adobat Hadloi Leheki, it's uncontrollably and it becomes abnormal. Asana Bish et Belakaki Din Se. It's identifying the body part where the cancer has actually started. So in this case, it's in the entrance of the cervix, not the cervix, it's the entrance to the cervix. You see, that's where that's at. So I wanted to go ahead and go over this as well. And this one here talks about what is cancer. The term cancer, it refers to more than 100 different types of abnormal tissue cells that begin, abnormal tissues that begin in the cells. So our whole body is structured with nothing but tissue cells. And as you can see here on this structure of a normal and a cancer cell structure, the one on your left, and that's a normal cell there. It has really nice texture to it, and it has the nucleus in the center. So all of that here is considered normal if the doctor or the oncologist were to view a biopsy or any type of tissue that's being removed and being tested for cancer. As you can see to the right here, this is an actual cancer cell. You see that there's no round texture to it. It's growing uncontrollably on its own. Even with the nucleuses and all, there's no structure in there. It's just having to develop and grow on its own, and that's pretty much uncontrollably on that side. So this is what is being seen by the doctor or the oncologist when they do view such type of testing that is done regarding the cancer cells. When we do talk about cancer, we always wonder, what is cancer? Cancer is a disease that develops when the cells grow, which they divide and form more cells without control or order. Like you saw on the previous slide on the right side, it's growing uncontrollably. That's pretty much what it occurs when there's an invasive or when it starts to metastasize. And this is where it pretty much started here. And it just accumulated around that dead tissue cell that turned into a tumor, and tumor is cancer. So it's developing here. It has invaded, the cancer cells has invaded the surrounding tissue and the blood vessels. And the cancer cells are transported by the circulatory system to distant sites. And that's where it's growing here into the other sections of the tissue cells and also in the vessels as well. So that's how it becomes invasive. That's how it also metastasizes from the actual site where the tumor generated at the abnormal tissue cell and then the tumor, and it's going to the other neighboring organs, body parts within that site there. So that's why it's very important that you do get the needed screening that you need as you get older as a female and as a male. And when I do talk about cervical cancer, I would like to let my audience know that, what body part are we talking about in general? And just because a lot of our participants, when we do presentations, they're male individuals, they believe or they think that, this has nothing to do with them. In actuality, it does, especially if they're in a relationship. A male's in a relationship with a female, and then yes, this does pertain to you. And in the uterus area, of course, when a woman becomes pregnant, that's where the womb is at. That's where I'm sorry, I stalled here. That's where the womb is at, and that's where the actual fetus is at when the baby starts to develop inside a female. So based off of that, the different types of stages, trimesters that a female goes through when they're pregnant and then giving birth, that all has to do with the body structure of a female's organs, and also down to the cervix and also to the vaginal area as well. So that's how things are structured with a female. You have the ovaries, you have the fallopian tubes, you have the ovary uterus, and you have the cervix itself, and then the vaginal area. So this is the part of a woman's reproductive system. And the lower narrow part of the uterus, that's the womb. And then the cervix, it connects to the uterus to the vagina as well. So this is the body organ that we're going to be talking about today. When we do talk about the cervix, what is cervical cancer? It's one of the things that we discuss when we talk about cervical cancer awareness. And it's a cancer that forms in the tissues of the cervix. And I showed you where the cervix is located on a woman's reproductive system. And it's usually a slow growing process once the cancer cells or the abnormal tissue cells and the cancer cells start to develop on the uterus. In most cases, I try to explain to my audience that if you have a headache, you'll take, Tylenol or aspirin or ibuprofen, it'll most likely settle down the headache. But in this case, if you have abnormal tissue cells on your cervix, and you wouldn't know that it's there until you actually get the screening that's needed, which we'll be talking about the Pap Test, HPV screening, the vaccination as well. So those are the only way to determine if there's such abnormal tissue cells or a tumor that has developed or is growing on a female cervix. So a woman may not have any symptoms at all, but the cancer can be found, like I mentioned, with the Pap test. And if you look at the diagram there, the cervix, as it's seen, you can actually see the cancer tissue cells there, and it starting to develop there on the cervix. This is what the doctor or the oncologist will see once they have the test results, and they go in and they check the cervix area, and they will make sure that they see that there's a need to go forth with additional procedures or testing that is needed when an individual or a female is diagnosed with cervical cancer. So who is at risk? It's most common in women who have high-risk type of human papillomavirus, also known as HPV. That's a main risk for cervical cancer. And women who don't have a regular Pap test done as well. Some women have a weakened immune system. They have HIV or take drugs that suppresses the immune system as well. So their immune system is not as strong to fight off any type of viral or bacterial infection. So that puts them at a higher risk for such as cervical cancer. Anyone over the age of 40 as well. That if you've had multiple sexual partners, and then also cigarette smoking as well. I mentioned human papillomavirus earlier, which is HPV. Those are infections that are common among male and female. And these viruses can be passed from person to person through intimate sexual contact, which is genital to genital contact. There's such thing as vaginal or anal intercourse as well. Finger to genital contact, finger to anal contact, even when a condom is utilized. So these are some of the things that we also have to educate and make it known to our audience that there's such type of infections that can occur, even though I'm saying that a female is the only one that has a cervix, but yet when we talk about human papillomavirus, it can affect both the male and female population. Then with the HPV, there's more than 150 different types of HPV that can affect the human body. Some cause harmless warts on the fingers or feet, which is considered a low-risk type. More than 40 are transmitted through sexual contact, like I mentioned earlier. And about 15 of these can cause cervical cancer, which are called the high-risk types. Low-risk types can cause external warts or genital warts that are non-cancerous, meaning that they're not going to be considered cancerous. They're at a low risk type. And the HPVs that cause the warts on the hands and feet are different from those that cause growths in the throat or the genital area. So a lot of this is not talked about, and it's also not discussed openly. But today I'm going to go ahead and share information with you regarding these HPV warts that can affect the human body. Almost all women will have an HPV infection at some point, but very few will develop cervical cancer. Just because you hear this and know that it may not cause a development to cervical cancer doesn't mean that you're not going to come in for your screening that is needed. You still need to continue to come in and see your provider. Make sure you're getting the screenings that are needed for you as a female, and then also questioning or asking about human papillomavirus for both genders, male and female as well. These are some of the external warts that can occur on the human body. And this is on the hand there. And it's pretty much showing all the dry type of lesions that have affected the fingers here on the knuckle area. It's in the cuticle area of the finger, and it's also on the fingernail area as well. So you see warts like that can form on the hand, the fingers, and it's here on the fingernail as well. And then there's some that can occur on your lip area, around your lips, and the chin area as well. Some can occur also on your feet, your toes. You see it occurring here as well. And some of them can be embedded into the bottom portion of your feet or your foot as well. As you can see here, the brown texture here, it doesn't have a rise like this one here on the fingers or the one here by your little pinky toe. So this one's pretty much embedded at the bottom of the foot, so that can occur as well. And this one here is at the bottom of the foot as well. And it almost looks like a corn to the foot, but those are actual warts, external warts that can occur on the human body for both male and female. These are internal warts. You did hear me talk about having to have possible internal warts in the throat area or in the genital area, but this is what I have here, and it's actually in the mouth. It's at the roof of the mouth here now near the gum lining. It's also formed here on the tongue. You can see those red spots there, and it's forming on the lip and the inside as well here. So these are what they're talking about when they say internal warts. It's not like canker sores or where you would bite like the inside of your gum or your tongue and then that becomes sore. You think that you have internal warts. No, we're talking more structured here like this. It's white and it's all connected here and it's starting to spread. You see the redness around it. And the same with the tongue, and then the lip is getting blistered here too as well. So those are some of the things that are really not talked about when we do talk about cervical cancer, when we talk about human papillomavirus, and when we talk about external and internal warts. So the HPV timeline, what should you know about this? So here it has about half of the new HPV infections occur in 15 to 24-year-olds. And that's why it's very important that you do question and ask about human papillomavirus, about the vaccine. And in most cases, HPV clears on its own. But for others who don't clear the virus, HPV could also cause cervical cancer, but vaginal or within the vulva, and in the females, and anal cancer and genital warts in both male and females. So these are some of the things that you need to know, some of the things that you need to talk about with your provider. If you get that chance to go in and see your provider for women's health exams, or if you notice any of these symptoms or warts that are developing, and you would go in both male and female gender. When we talk about HPV, there's such vaccines that are out there. There's two major vaccines that are being utilized. One of them is the Gardasil, and it protects against the HPV types. And these goes by numbers as well. And it's just like drawing your blood. There's a certain number for such and such within the blood circulatory system. So that's how they determine which type of vaccine works against which one. So if you see Gardasil there, that one protects against the HPV 16, 18, 6, and 11. And then the next one there is the Cervix that protects against the HPV 16 and 18. As you can see, the Gardasil protects against two more additional one versus the second one as well. So just because you get your vaccines, it doesn't mean that it's going to protect against all HPV infections that cause cervical cancer. Even women who are vaccinated, they still need to have a regular Pap test done as well. These are some of the HPV vaccine recommendations, and in most cases, it'll be the hospital that will be informing patients or the parents, the guardian, that their child, when they reach age 9, and they'll inform them that there's HPV vaccines that need to be done or need to be given. So these are the recommendation guidelines that we're utilizing, and that's being utilized as well at the healthcare centers and the IHS and 638 facilities. So for age 9 to 14, the HPV vaccine, there you get the number of dosages is 2. So your second dose is, you get 1 dose, and then 6 to 12 months later, you get your second dose as well. Then the third dose interval is not needed, as long as we bring in our child or children or grandchild between the age of 9 to 14. Once they reach age 15, all the way up to 26, there's 3 dosages. So if you get 1 dose today, 1 to 2 months from now, they'll be getting the second dosage, and then thereafter 6 months, the third dose interval is going to come into place. So I like to educate a lot of our parents on this, especially the young parents. As your child gets older, know what their vaccine recommendations are. Always ask questions if you're not clear or unsure or doubting yourself if this is a vaccine that your child will need or if it will benefit them. So it's always good to ask questions, and it doesn't hurt to ask your provider questions as well. So keep that in mind as you continue to take your child in to get other vaccines that are recommended and needed, and go ahead and ask about the HPV vaccine recommendations as well. These are some of the possible signs of cervical cancer. Abnormal vaginal bleeding. And this is a very sensitive topic to talk about as well. So you'll hear me having to pause here and there and having to provide as much information as I possibly could so that you guys have some understanding and know what it is to look for and where to go as far as like navigating yourself or having me navigate you through the process of what needs to be done at a certain point, as we're going through these presentation slides. So it occurs when bleeding that occurs between regular menstrual periods after sexual intercourse. Some women douche to clean out their vaginal area, like after a menstrual cycle or a pelvic exam, and after going through menopause. Menopause, in most cases, it'll start around age 45, going to 50, sometimes a little older than 50. Some women go through menopause where their menstrual cycle will completely stop. And then menstrual periods that last longer and are heavier than before. So this is where you're monitoring yourself as well as a female, making sure that you are going through your regular menstrual cycles, knowing how long or the duration of your cycle is, so that if it's lasting longer and they're a lot heavier than before, then you would be concerned and make every effort to see your provider as well. Then increased vaginal discharge. You shouldn't have a large amount of increased vaginal discharge during the in between your menstrual cycles as well. And it'll cause pelvic pain. It'll also cause pain during sexual intercourse. So these are some of the things to look for as far as possible signs of cervical cancer. When we talk about cervical cancer, there's such thing as screenings that occur. Some of us are aware of it, some of us aren't. And as we go through the slides here, you'll understand as far as what the screening age requirements are, at what age, and then it'll give you a better understanding of what a Pap test is. So when a Pap test is being done by your provider, it can find abnormal cells or cancer of the cervix. Finding and treating abnormal cells can prevent most cervical cancer, and also finding cancer early when treatment is more likely to be effective is very important as well. So this is what we stress, and this is why we encourage women to come in and get their Pap tests done as well. So these are the recommendations, the Pap test recommendations for women, and it's age 21 to 29. A Pap test is recommended every 3 years, and that's if it comes back normal. If it comes back abnormal, and then the provider will walk you through on when you need to come back in. In most cases, it's within the year. They'll ask you to come back in and repeat your tests, your Pap tests as well. So those are some of the screening guidelines that is normally followed within the IHS and 638 facilities. Then ages 30 to 65, a Pap test only is recommended every 3 years. An HPV test only is recommended every 5 years, or a Pap test combination, which they call a co-test, is recommended every 5 years. Some women who are 20 years and younger, they really don't know why or what a Pap test is. So I have some information here that I hopefully will help and guide you on how a Pap test is done. So of course the patient will remove everything from the waist on down. Usually the provider will cover a sheets over them from their abdomen on down, like you see here in the image on this presentation. And that's how the patient is protected as well when it comes to the provider having to do a Pap test. A lot of women are shy to get it done. A lot of our women who are a lot older, who are very traditional as well, they feel they feel uncomfortable with having to get a Pap test done. But when we do explain these things to them on why it's done and what they're looking for, in most cases, they make every effort to get it done. And then when they get the results, then they understand, why it's being done and how important it is to ensure that they're getting their Pap test done as well. So the patient will lie there on the examining table, and they'll have the sheets over the lower part of their body. They have what they call stirrups on the examining table as well, and that's where their feet will go up, and you'll see the knees of the patient up as well too. When the Pap test is being done, it's a speculum. It's usually a plastic or metal device that's placed in the vaginal area, and this is where a lot of women find the discomfort here. And this is what is being utilized to open up the vaginal area, and so that the provider can go in and see the cervix here. So they open up the speculum and they look into the vaginal area. As you can see here, the steps here, what they're doing is they're doing the Pap test right now as you're looking at this here, and then how they maneuver how they're going to be maneuvering here to get some of the cells off of the cervix, and then they'll place it here on this lab platelet, and that goes back to the lab here. So the cells are here coming from the human body. So those are the steps that are taken to do a Pap test. So this is what a female has to go through when they go through their Pap tests on either every 3 years or every 5 years. At some point it was done on an annual basis, but a lot of that changed. So it's every three years or 5 years, depending on what your provider would like for you. So here, and like I mentioned earlier, the cells are scraped from the cervix and it's examined under a microscope to check for cancer or both or other problems or issues as well. And this is the cervix. It's viewed through a speculum with the patient having to be this position to ensure that they are taking off the cells the cells needed off of the cervix as well. So cervical cancer is diagnosed, and usually if they have an abnormal Pap or an HPV test results, other tests are used to make a diagnosis when we do talk about cervical cancer diagnosis. And one of them is called a colposcopy or either a biopsy. So when a colposcopy is being done, the doctor looks at the cervix and it's with a lightened magnifying instrument. It's called a colposcoscope. So they usually utilize diluted white vinegar that's applied to the surface of your cervix. Then the abnormal areas will turn white from that vinegar that is placed on there. And that's what the provider is looking for when they're using this instrument here to look at it a lot closer and to see where the abnormal tissue cells have started to develop on the cervix. Further tests may also be needed depending on the results as well. When we do talk about the diagnosis and also cervical biopsy, there's what they call a punch biopsy. Small tissue samples are taken from the cervix and it's examined for any type of disease or other problems as well. So that's what's being done here on the left side is the punch biopsy right here in this area. So that's what they're doing. They see the abnormality in this area. That's why they're taking small tissue samples off there. And then this one is a leap. And this was an electrical wire loop that's used to slice off a thin layer around the cervical tissue, from the cervical tissue, around the opening to the cervix here. So they're going to start here and just go in circular motion as you see here. And they're going to take a thin layer of this off. In most cases, the provider will inform the patient that the cervix may not be round textured like this here because they're taking off a small tissue. Maybe a small amount may only grow back here. And so, those are some of the things that you would need to talk to your provider about if such a procedure like this is done for you. And the other one is also, this is also another biopsy that is done, and it's a cone biopsy. And this one here, more of a depth of the triangular type of tissue is removed as well, inward into the cervix. And this one here, the tissue as well from the cervix that's been removed. In most cases, it's not going to develop all that tissue back in there because it's been a large area of the tissue around the cervix. It's being removed. It's going to be tested as well for any abnormalities and for cancer as well. So these are the type of biopsies that can be done on a female if they should ever end up with an abnormal results of Pap or either end up with cervical cancer as well, for additional testing, additional procedures that need to be done. So as a female, how can you limit your risk? You're having to limit the number of sexual partners that you have, using a condom during sexual intercourse. Don't smoke or be exposed to secondhand smoking as well. For some apparent reason, all the different type of chemicals that are put into one cigarette has an effect on a female's human body for whatever reason. The reproductive system area, it's just, it's not good for a female to be smoking because you're putting yourself at a higher risk of having to smoke, having to be exposed to secondhand smoking as well. So this is what I have for you from the Breast and Cervical Cancer Program, the Navajo Cancer Prevention Program. Our information is listed here as far as our address and our telephone number, our fax, and then we also have Facebook, we also have Twitter as well. So if you have any questions regarding this presentation or would like more information, you're more than welcome to contact us. We would like to provide as much information as we possibly could when it comes to cervical cancer awareness and to ensure that we are reaching out to individuals that need to at least have some type of information regarding their own health, especially for women 21 and older, and also women who are having to go through any type of biopsies and having to get diagnosed with cervical cancer. So that's what we're here for, is to try to help you as much as we can, navigate you through the process and getting the information that you need, and also to keep in direct contact with your provider as well. Thank you. Yat kodo ya teacher. It's isbit all that and say other part hadloin lehiki is sunny beast bidlat haki other with opa hanegi the hill day leto the hill a day leto the teacher. She a change kinensla tapaha a bashis chin kachini the shadow to the chini national Rolanda Todecheenie a inche on the Navajo Cancer Prevention Program a banash case management specialist Ainsland lay Inleidje zel in befacht zo de aarde samin dat benadli de aarde is nationality. Dit al ja, het is met al dat een zeho arabat het long lehiki. Do even de gani catch a cancer no yo zileko. Ik kwado het al bij je ziltjo. Ado dai da gida baby likit na hojel now. Do wat is honest je not ilo. At ela ho. Ano on the dato yan le wik a betratcha ado dai kya jit injita kindan das jaja ado kida jit on dai aja betrato slita o kwa ba ya just here ho isha ba adam no sino le ado on the da which is zingi ado on the ya wik a the nigi bilkeda jit nigi do na a yoda jo nini hot ona bilkeda jit on ho a ade a hot o paint in hoda ado dai da hot o Haida basically how no ahot abet is being the cancer or the hegi ho. Hashil so with a lato be nice to tindo little ho. Which is zeniki halate a hila dola ila ahlila. Point no da what abin nice kito little abin jagado little adon da equire. Which is done also to a lato a ishin lato be a angel what do alo shortly la ka without any deal with oba hanne wins no da e which is in give in the ata na was in the question the hallo da because the nani the hallo da aro da so kapa nali kapa yeah dan lingi she it's for with all lato baby because there's no little book lato be papa was in the ben not in lo da with all haida ya painst ido it's is with all that say other part long leho adon the idea it's is when yank iho jokado ya stand beast bilat ha with all by ya de hit aja hashin so with all hida paint in hospah was in what ye was hadne hota ada abai buchi just hit adon the day opposites in gi with all paints in gi the way ya asatina long hope del in the don del adon da ya tila ausche na hot ila no khida na bedo nehleko do win no hut sato ba haya do sato biki dest in on nehleko nana di khodo hashin so ba na hashne ko ad na bazaja aja hut sad leniki el kesenel aja hut ochdenil in the snow ko ba na hashne di khodo hashin so astande bist belat khahi do hut akwa cervical adon da e cancer at isbet o datin se hobat hadloin lehiki e khashin to wat o e saden lenigin dasik o e le horjishta e lodo not zihi jo wat o de yojin that the cancer akon hidne ko e azel indo o daily shikito di belastlai o bits is e khadet e bel daily shiki e hashin so e dit out saden lenigi e wat out they need at is but all that then say alobat had no lehiki astan bist but not haki then say so at is but all AD a belasta in lenigi a bit easy had it kon they ket at on they bit art in the ko but sunday art and the ko AD it's is but only had it a human body cell no your g ko pelaganic at it that didn't say that develops and grows I don't know that a bad no leho e hashin to she pa huinzen do nana kwa naska do e aja hashin to bazano e kwa e bits isimliniki against e uncontrollably and becomes abnormal do ne abelagana catcher I don't know that I ha I kish e hutza e bits is hadit e ha I kish e hut opa beinst e do basili do e stan bisht it belatcha ki then say in the entrance of the cervix do ne e aja hashin to o san linigich de ni kotisti of kalbi the code e aja hashin to belastra in linigi with o being you to I thought of not see names e da but no she hit oh yeah to the cos be she been e a dola and dot zeta o kodla e a kodja shana hun ti la ko ashi ko winzen abet say the hajagata abet say the binyan na bil khada pohone za azel in a khada lo shot e ko ti o the cancer li higi what is being the at is but all that then say adobat no ideho zashkait o e achtechnido khadit o e ya daltio e achtechnida shi winzen la ko a wat o shi vatsish de kos adotaida benaish azel in da wat o benabish ki ko e di aja wat o cancer li higits e art o shi e at isi not e allan is not the na e that o AD wat is but oligi wat o ye not ilo ko di ko e hashin so ya had ne ho di e dot hadan di is but oligi jono o dan mazo wat o kita di jono ne on ne sto ko e nuclear station e aja wat o di at is but oligi wat o de ho de yo onda ze in den leniki adon da e di koja at is but all daten bad a hanoid le aja e ya daten se ho e aja ze in e aja e sila in ye na gadon yasata ho oncologist de o de nel e ko de koja dot adan ko adon bad a hanoid le ho adon daten se ho ya obodli chiko o datin se ko tikat ya kwa nas paso o jno fix ne do le len kat obodli jo datat nisa tit a shi de yo ile ko a khit a hoda ba da hat no ile ho alo nach da ho de il no ho de ki sho da nach ho de il no ho in de din dis kha tit o de ne ile ko nana di kuji ge at isbet olegi hut abata no ile hot tatun seho at isbet olegi hashin so to apen nach hut in hota di a khichon khili bikta hot o aja hut o hashin so apen nach shi hut hodan ne din hit isbet bethan ho o kan den tle ho da apen nach hunna ho da nas olki o tlis na mo ben now eti artis ne ko abnormal tissue cell de kliniki a khait a chi ya bad sedlio do apen nach hunna ho nasi na olki o tlis na do artis ne ko nasi ba at no ile ho nasi den se ko what auto bat hit o no se so da ein chai le nasi o cha da an ni lo nasi ko de yan le what is ha what san le ko a bi gat yeah aje da big da se le what os das ti ko aro da le what de what os da aje dan ti ki what to da aje bi da se to nan le what san le je da what ti nga je da je da na it je jo da na le ko aje invasive and metastasized the clinic ate na aje what they nash on ko di aje zel and dan le ni ki yen da kai don ye what os da ki ko di ko jige ya astan aje what ye ni chi ja aje what be hadit hagi ya kwa hasil so Nihil istana de shiltza hagi la ya shi huinzen la hut bein dat nil kino ado dai ba ya atio an le azel in ba jugaho kon na la ba ya ati ado dai da hut ye hanat za hagi la ahilnila jo stani sado edi kuna ad wegi hut no sele ko bish it kun ho ya de bidlat haki ho cervix gi AAD aja hut yisi ba ya del ko azel and then they hut out astan be astan hut azel age iga to hut di on north east of the no da ko aja tadan here hot a di ye on hut di I ho zel and it di e basan ye ho AAD astan bist belat hagi cervix edit koten john di dot the bat then what you go gi ho ekwa ekibas ho di ahisne ko ado und da what petit it na hadan ho astan bist eben na what asad the nigi al kesen ho at nek ashben na ana But hadlong ile ho di at is beklonigi hot about hadlong ile ho datin se ho astan bist belat khahibin se ho jo I khashil to to zait bahasanda jo la ho ya ho tit in dinni ho da tit in es go da arch bin yeta az la jil de ho Tylenol do ibuprofen that aspirin da arch khashil toy khon ko ako di kujago agi dot da ako astan bist bedlat khahi but za khait da ajo ya just astan bist bedlat khahi but bahten se hodi abnormal tissue cells de klinigi jo dik an ajo but benst no ya yalti ho thod na no basni kon de bist bedlat khahi kada hot de na do kadia da ni zi ako aje hot ho John le astane hot bin na betul khaho aje shi do le ko at is with only ba aje na cho de ado on the time le dal khaja aje on the ade na ta zel any ye da hadna ye da hadna ado da ko isto aje but nel bin yahut nel da aje ye da hadna ko ko llata ya nes go da ni llande ko de lawn hun nes go da no da hot zel on da ya hi kha sani ado da ya sani hot bahazno benst do da ato bin yana na badil kha don nes go da dot da no ako ay si di stan bist ho belat khahi bin yana des kha und da be ahazan do de ado nan khat ya do be bahazan da do de no ya da na ko zel indan benigi ado und da di ko je khayla ay si sani jo sani ebidet idadi niya ish khayt ya sani khayt ahkito khanch it ya aj big not ito hot yin yi khana ga do le jo ko do ya had na ki DQ human papillomavirus, HPV, no yojiko. The neck oh, busy atan of the human papillomavirus. Tostoitini to nikishinte. 18 le yusin le at least with all donana di kodobada with negi kostan the beast. But latkahi adon le it's awesome does it was a han she oh yeah about le to yeah yen da kha to ajo osad le nigi or kit not this nigi for the human papilloma virus they HPV with a son to the natural to with big not with and in the hashil so oh yeah that net ko adonana gi ya a son le natin asha don't watch it na go bishit or a son bist but lat ka hi gish with ban nas khato le lan khato ya ta khata ano dai dan le Disney non watch it dan da beda khaw dan da ya hi khata ko ab don le natin asha to ya الكي من دي من أخي كيبيك يفتح زي لأنكم إيش لا دنيا يهدا كاجي جاي خشين سو أشي بيت نوت إيش أنه زي لأن نانا دي وات إيسن لأنكي هو immune system no yoje ishi di what isen leniki shi the kosen leniki the kosen sa da egi chosto ini da what isigi gained either one ni da hashin so kodo aho ka another what the immune system the leniki ajashin di the kosen leniki one leniki shi sato ye ka another ya nacho cuando nesto yan yat einstotlich hashin so di sa aho yat ndal kiti be immune system li hegi ho sani dos kwisa ya HIV de no de yoje aje ze la nyete de ko aje hashin so shi di immune system de kliniki hot of lato but isigi ka another what do they len the costo and the cost tada points in the ya au ya da up next kido yan di da no da ze in the nan tin le ko sa to da hot point on the di ko che o di at is but all that in se about a had no in the hige stand bist la kai o khashin so with not ifot and I don't that diho nach na na latest din no no cho nach go a to si be da hosin zan do le ho zel in on de kha to ya na no I don't that ya sexual intercourse de ni as at aste I hasil so to to alla ge ya bitches kid ya the quigoda the neda sanda jila da the hasti da to danger neda to ni ko fa list quido sanda the page deal what do be hundred asha she ashi ba da no da hada it neda pas and sanda khida I dying Hashil Soikil Hanat Asota ando the Quigoshi of that or Ashi be at the Hushit of Tihut Echo Ecuador Sato Yahat Neko Nana di Lake Hindo not for Dart or Hoki cigarettes de Kliniki Apart had not stop ate Zadashin la Hot East of Bayat Hekishi be Iliado Bel Iliago a cocodo in Hashin asked with Sani dande Ndelt Oyana Kaiko a quich Ashinedla Orchard Josh order 80 with Isigido Bayat Ashiba at Hano Echo 80 could Alcodo Yahat Nehela at the Snila Halit or a quite not ilto hilabando nenike dikudo ayahatne. Nana dikudo human papillomavirus the snowbahashne HPV ako aja hashim so to Hila si bed not ilto ay tabacho na ako. Di denne stquidan lenigito nana stan di hashim so hut abtai hut bed not ilto ye ya be ihudit hut ay di khalit hitlila ko di aja hut alhanjit asuta aja hut binst indo put hut alhanat asa aja hut bed not ilot and ho nana hut sani do hastquida alhana khawda aja sexual intercourse de kliniki aja hut ki na beninada hut llato dod hada ya aja be bohosh dolt shi hashil to di jeta gazi or ya higi ho condom jashi chjol ind hashil to be dohosh dolt to be ashi ba ta no ta ko be hashil to islen gibin to ba tjit do be yeda zel jit ga hoda to hashil to shi ba ta no ta ko di kodo yana ge ya zan shi alla de nesna dino ba shlatin di kodo HPV shno ba shne di human papillomavirus aja hot is shi ye not ilot di kodo adlad hot ya hadne ge ya di le thought na ba shi ba hadle di wala ta ko keda was it on eta now that they would now that so aja hashin so she but she had loaned to ya ya the world she the cervical cancer ya hikishi do ye go she be not iligit and a low risk of nas ido ya hunzen a konde this niki di kwa yof gi atlan nes na din do ba slat niki aja alkhana asja aja this aja bahazan go be do hoje doft khida bishant aso ada onda ta ado this do gi ya ashlat ata aja di at isbet tachten se ano bata don lege stan bistet belat kaki beit not lot ko hashin to aji ya bata lot la ko nana di kodo so sno ba yashki di al ko beligani ke warts no yo je ko an le la do ke do ze zapan en le ko tagi on da ba to le lot adon da di astan Yeni chija aja ko aja ya beit not hado the magical to ni ko ke na ko na da ka ko ashi ba da no azel en ye sahat na le azel en da ba ga ho ado da ba khitna ho jilna bna kito da dort is art ye khadne da ado nek actually to ba to neki to hashin to shi to shi to shi ant zait ba to neki shi abebe dat nikle hada di kodo ba ya tio asane bits is hadet age ishi to ahaslagi ba ya tikande ishi en the wado de win zende de ni hast we don't hizani a konde di kwa ben no tito ni hitene ha job istan dodli ja hon zendodli ye ta hon zendodli ha de shile ye na tindodli ha de shile Passion da has leo da but so keben na le kepa a yeta da no da has leo da just lato ye na tindo de queen zeno what ya katishing an de has large what be na tindo what hashing so Suzanne Lingi did that ko di could external warts de clinic 80 for kaki bazen no it le what lagi what ya bait not ilot and ada on the di walashkan di betlahan katla batas ni ho nana bacho na anko le sa alhan da kagota what le the nedek what aj what ya sa le astandi ni chi do ajo da what that contact on that side go hashing so di beta don le benada słoda no tlelot and the awards the external awards nasi di hook da bata do lechne ho bazen no shi di plod na lo shi da ba do lechko nanan le ket ahte sto they I seen le ha khati ada do le ado tai da le khaki ki tsajo da no se na dina no ko la te yan le ko ke gi ket ate di ko da a kat le de ko khage gi a pe del ko na do shin le bi ge de shin a ba do de ko ka sto ko nanan le ko ket ate sto di a ta ko ko ta shi dan zo na no now ya dat se da sto shi be da ho jin zin do de sto ada wat shi be na shi ka do de sto أخذ هذا ديت أبا أخشنسي أنتشي زي إن باشلو قاش وزي إن نيجي باشلو قاش لو إبن عشان كيلتي لخد أخذ إلى دودي لخد أخذ زاتو لا أتأدا نه جو دات أهو إبن عدي كيدو إخشين تو وزي إن شيء يسي أو نالتو سكي بيك أهو ديت أو فدين دوش خاطو دي بين يدو دي تاخذ نوضة أو إياه نتلقى زي إن نيجي دي يا خزي وناشي شي بحطو لي صوت أنا دي أو تال كيكو نهضو أو صوت نهضو أو تتخشي نهضو أو بحطت نسيتي كد إن لي بوتشي إن أهاجي أو دي بوت أكوا دي كد كوا بانسلي الناس إشين لي بتضيق وياكو أدون دكوا بتسو بحطو لي صوت أنا لي بتسو بتلاقي بتدا دكوا أكد صوت ده تنتلا the internal warts they clinic kada with obin state about no ko with iho ado di ko abada with human papillomavirus HPV with o khashil so shekhet o pohotel ni do khalit o inal ido ile yan da khashi min zentla ko di with o ndel khaho astan adon da ya ortskado chike ajo on da aslat ata na khadon le na tin jo be da khige pas no khot auto ye ta halya do ye ta hon chen no bo lo o sa skuido san da khai lo so da ya hashin so be not lo au ndel kha hashin so ajo be da khige ye ya da hon chen ko the human papillomavirus the shoma by yeshti ya what's eason then you paint in what the other died of it ba hosting Jose in na hoska that did all means in the no the kata up in that what in zel in the ado fa do ya up in that what on na in the zel in the what obin ya na di on nan dos kata that no that is sanjugo is ye bahast or the in le astane bist belat khidon le nana ajo but bist that ye not isot echo as squidosani in the bahashne internal and external warts. The thought and the hidden clan became cancer to a hashing thought of big not a thought and zelen. Although the human papillomavirus HPV a arjiviniata a ze binya ata at seko na kibe at and zelen a deco of chill the bukagi a quanta bejeko gardasil bechneko. A D de Yostkaho 16, 18, 6, 11 no a Yostkateko. Alo di Sagi a Anaki o ye nas ye kites e do o yin yendas ka ye no do a she a ajo put on until be lagi don hitne the last line in clinic has job is done wins and bin ye what dit ja nada ko rashi dit o tsedo ze before o tsende di ko HPV und ja higit it's at hit aje but to this to bin net do this von der di ze ge ko cho do this chisto ich nie ba dort to gesehen ja but klato yin dan do di san in die kliniki rashi dit bin ye na otsende konde di astandi bist belakhat na khagi pap test kliniki pap smear test kliniki e na ito de aj basen sando di ke na da khagi shi be jon ki istan na de nana di kuji ke ya de kwilla nach go gaan la khaled a hlila shina winzen HPV Vaccine Recommendations on the Nast a benda hagoko, Tilke do chicken lenigi, a other she is a they Disney doba slap the nachajeho, a ajo o a bada, says that said she badly. Anaki, she would all as they give a bad dot seco. Saba aliagi aron da ibikedon de strandes da ala nachaje kan gibit khashi but ala ekedo ki na kion ege ban na dot niko nana di ashlat ata nachaje don le natin hastha ajo of nachwa e di how if kid na option o zeki the human papillomavirus vaccine clinic issue with obispat of no young neko zalta ba ya gi alon the bikid of na kyun ege ya sa alon le na kinder zebkashi e ade ba na do nicht adon the age of kastinan in this kan na de she o town ege she o ege bispat of o kid na o she ya Del kato ya da hun zenit au di zel in dan litigation au skip na au edit au bin ya da tsda no ya da hat ko na di koje at sanne bist it bedlat khai au di it is bit oligi ya pat no in le hot den se ho e she khit au be ahzen do be to khalit au ya bin yan na is kato le shi vincent le ko di stanjigo o anna disease began the more did of a shield sofa sani di sani anna disease of in the lege arch she Satoshi ben nada idis kato the hen sato sao do that in the co arch hashil so menstrual cycle no years in the garnic arch hashil so um Lahota hot o zan kushi aj yos kasi gib ho sa a di khaja da hot o bio ne bkhant just la ya sa the mo sa in len is nice khaja da bio ne bkhana hot just len za go da hot o pinina hot o bike khanja ga da shi le hot tlan da shi ne skasha do na nan de allan at asita hot o be but on Delhi nahitin tlau she about no loko adon dan le sani iga dahle le annahitin zido aben hatle gi menstrual cycle hashil so but anne hut zan she this ding no ba ashla din khagi shi ko nach hashil so the menopause legi ajo بيونا والخاطر الجيش له وسطان من الكلينيكي آجد نا أونكو بيونا تامين أهد بيونا والخاطر الجيش ده آدون دا بكيرو دا تكلينيكي دا بانا حسنيتزي دا حسن تو شي بعد لون دا كو نانا دي ساني الكلينيكي آجو the vaginal area آجو حسن تو discharge the clinic Achit ahoda aha na do hot oile hoda ado bini na da kwa hot the clown da khudin ni hoda ado da dan le idna as iniki da abe khamjut asda nani ka hoda ishi aba da no da ko di ahshnia di aba hanne ko hashil toshi Sahoshi do hot aba hanne dan de adon da shi ya dan Ada anan ko ada nebza je job hut jo zat bahadon higi is as this ko kwaigi ahan shed kwa azel in da zini kha da zini khai kha na du gida kwa zel in ya kha na da zat dast anago ahan shed ya da hat na ko to zat di ka pa snake ya da hat na da ho o shaba na sen no le ko alo di ko jaba na hashne ko die het is before dat doen se about no ge stan bis bedla trahi o is het anders ga ja bin ja ga de pot o die nie da ga ge ben nach around da ibet khai de question nach da de ni ka pap test ho de bin ja het o Quist billa trati bin yen na hot il khahada di kojo hot odds isbit all that dun se ba noin le ho arjin yen da kha ko di cancer yagi aber say de hot achit ahada ba noin le ba hoda hat ni hoda ya zel injigo ya hot Banajda ahada ka da lo so tan le ko shaba no sen do le to ada da you see the at is to colleague o ba da no le ho da den se ho ada da is dan bist bit the kai o cervical cancer the cancer de clinic hot o ba Beinst da bonne za hot o zel in la to ka do lo so ya but say da do ya on ne doi ada ya hot o na hot na ito de to ze clinic shi ya ku ho ha de do de ho Ado khila yisi ya hot on di kha to kudo ba to na zanna din ahla na khigo sanje long shi di pap test gi ba do ni ko za te shi ba do di in le na din so je ajo o hashil to shi kha na kha kha na atle ho ajo o ya ye na da del kha to le to aji gi ho nanan le khatilo has khatilo ba la kwa nach go an le khai kha na khato le aro di ko HPV test ne aje hot apa hot ya asla nach bit khana atle ho and dai ada na ito le adot hada hatno زي إن فنيس خاطر بكتشي أجدود هذا نو أجد أو يأكل هنا أو شيء يدينا إيش دو يفلت دو أشلو أو بنينا بس خاو نانا دي كوجكو تست لنيجي دي كو باب تست أو نانا HPV تست بقى the dot هذا بعد دو وهذا شنو ده إيش لا نخي بتخنا أتله ده إبن يهان جدا ده السيدة أي أنا خابك دال إنك قديش لحظة أو إياه أنا ينا داشمو إكدو أبي داخل بابا داخل ندو إيان كيب نندني قبل إشتان أديني لزن أنا خليت أو الإله زنه ليه زي الإن باجراه إشي زي الإن إيه كيف أنا أو يخدنا لكم أدي أجا استنى شيء يقع لي بدت لون دو ياغو شيء يقع يكداشتي أنا أدي كاش إيه دو كاش إيه يجنا بيجز إيه ينج داشتي مثل إيه تداشن تيهو إكوا هو بدي دو ياغو يكداشتي هو أدون دا إيه أن ليزل إن has أن إيه أجو أو examining table ده كلني هو أوش ده يخليكو أدون ليه هو كير هو كت خليجي هو أوفي هو خليجي هو ستر ده إيه يدي إيه بكاتن تيجي هو examining table أو إيه هو أبيونه بيشتل إسي أدون ده هو بديجي يا أنا هذا أوشي إيه هو أو زي إنه كنا خشون هو إيه بكأو هو دارنا هو إيه دي أجا هو تدرج تيتو ديت أو إن له خشون ده إيه دي كأن أحكي دي كأكي بيش نهدلنا هو بيش بإليادي لي صاني جيدا لشتو هو the vaginal area إيه دي أجا هو إيه دي كأكي دي اي ناس اي دو خليت او اي اجا تسبت ودي كيسا اي اجا ين داش خاجي انسا ناتشو ودي يسي اي دو يسي دي كنتي بيش لون بإلياجي speculum دي سو دي يوجيكو ادو دي كوي دي تسيتوكلا ناتشو ودي يسي ادو دا اي دي تخزسنا هدو دالت اوزو دالت يسي سو اي اجا باهد اي ادون دا اي ليدي يندا اشخا جيدو اي اجا او فاتو بنانا شملني جيدا يوسن كليكو اي اشي ود او اي بي باب تسل يهتشننيجي اي دي كوجا اصاني بيشت بدلت خاي اي اشي دي دي بعد اتن هو اي دي او تدشن تخيتو شي زي الانشي دي او ينال او دي يسي خيديس ايكو إننا إيه أو قائد إيه قائدان يو ديد أو هنا نهتو دو بدنش ناد إشين يأخذ أو بنيان دا الخاصاني نتلني جيلا داني لأخصاني لأن ناستاز ليجيش لاتينو بانش لاستخدينا بيدا قايجي يأيه دانو يندا بيفكيب إدين يندا أشخافي يسين يه أخذ أو إيه دي Pap Test gidi yo keda bedishno ashon laada tino landa ihleo o zel en ezel en astanen lo ezel en e o shaile e a kodu de nachigo e do tada ni hla akonde hla ya ada hunzen the nachigo e a idea ka zel en astan bit is khatit a idea hla konaga كوندي إشاعة وديش تو أتكي فلوشة أدونيش تو يا باي بنات أهزن نو ده results اللي هيجي فأخد أنس دا كيس ود حسان دان لنيجي نانا دي ود أستني بيشت بدلت خاهي يعني ود دا أشكاهو دي cervical cancer اللي نيجي هو ود نهو دلكاهو اي ادي نالتوسي خوانا الوقتي لقا اديد او دي لسان لقا بعد هز ليك ودي تسيس بتقوديكي انا صنع نادوش خاطان تبشنو دا او اي خشين سو اي زي الاندا بتشخدني بالإشتان يوسنو اي دي diagnosis الكلينيكي هو خليت او اي يجي ناد نول اي لقا اي دي او بي دست ايكي شيء اج تسيس بتقوديكي شي اي اد اكخوا أو يوم السيدة باهوش نأنجنو نمازوخا وات أو الكدا ديت هو دوت أهدن كن لاتجو يا بودي جو تنسا دوت أو دي يوم دا شيء تو دي أجين يبين يهود أوس أو يدج نور تو بي بدوت إيشي تشدي دوش أرون دا أكيد دي يا ساتو أو خدي ديوش كيشتو ين يأخد أو داش خاهو سابش نا أو نيشتا نو داخد أو أي شاتو هو آشة هو ADD أو بايست كي كونساس أنكو بيدست كي أدا أيجيدج بنور إيجي هو شيء وتأتش ديدوس إيجي هو AD أو سنة تدانا نستيون دا إزاي إندا كدي أو دي هو سأنيجي إكوايجي سأهو يونا يدس إشي آد أخد أو يندا أشخاطو أو شي الكي هنا أو شي يبتلخدو نهدي أي بنيهدي أو دا إلنهدو دي أدون دخل بدي كجنو إيا سايدو دادانو ندارتيه هدا ليد فستان خويش إديكي بلتخاهي أو Cervix جي أخيد أهد أو إسبت أوليكي دنسان بعد أهد نفس اليوم اي اجباس اليوم دو بعد كجد او ناسي اي دي اشي بعد نو كانسر يهجيشي يا يكويد نوت ايفلت اهلو دي كدو اي يا باج اونا انكو انا صنع نادول خلاهو حتى هدول كيش نودا اي لا دي او دي هو punch biopsy that's easy go did دان نظر هدا هدي كيش دي دي اي بن يان كو دي اي او ين يأخذ أو جنك حتى نلشين هذا نكون دي يسيجي أي نحجه ديش نيجي أي بنيان دولك أي دي أجه أو يداس نانا دي كوجيجي أي لي ديش أي دي أزل إن بالخاص أنجا أي أجه خشين صوت أو ين بنيا داليا أكو أي دي أجه دي نشتهو أي دي ستغو أو بنتي أكو electric wire loop this long ko ADC ko igi but sali ba sali o dashi ahot go na so ko de do this did ado in de dos ka digit issue hot dos ka bin ye hot das ila do hot bin ye ya na di das ta hot no da bin ye zel on da na jo ta Nana di kujigi la nana de ajo zaid injo dacht also dacht so beschen de ja da den nenigi je diskish nikat kwa de la sto hashin so de go di utsan na cho de di kuje astan bi digi باللت خش بتأخذ إيه إنديج بالخاطر دو نيخ دو إنديج إن إنه سيف أكو ديت أشي بيخول دو ديكو إيه خد نادا أشكا دي خلونكو نو نيخكو دي باللاج بتسيد خد خشين سو بي أصلا هجو ببكاء دو وشلو بتسيجي خد دي بتقوليكي بعد نوين لهيكي تحتن سيهو أصلا بيش بدلت خاي بيدنوت إليكيشي أي سي بني أخد يا ساتو إليكي نو نيستي لك كجيجيات إهدو لسن تقاتي سيدا بين نسخانة دو يا أشهون دا ديشا دي نان دو لس دا نو دا زي لإن الكيسن دا نو إبي أحسن لكو نانا دي السنة دني تلينيجي السنة إتليجا جاي ششيخيت أو بي تا هشيانو لخديت أو بي أتا أهون زندو ليش جو شاشي وت أون ستا كيس أشي يات إهو دان ستا كيس دو هذا دا لي وت أو شيء نوت إيش دو شيش دو بوشان دو سنتا خديت أو إيا بي إيا أتا inst edo lecha ila benne inst edo lecha ila yakwa pahazano ina antindenigi biselagi job istan ag ion jona bla shla indenigi den stando magical architecture di kwa bach na ko de khana asajikota de kwigota sani stkwida obatkhajol wosota shaba no da nana di jeta gazi shinigi ya adashi binye الخانات أشجب يشي أو إيش تجوش إيدو ده فتوشي بتصا بنية إيش دي أو جهت غازي اللي هي إيش يشتغل إيدكم نانا دي نات أختشنا كون ليك هدو دارت أوجي أجو أو cigarettes ده لأني كده تجوش أو أشي يابات لون كو إيه خيدا فن إيه جيغا هاكي just هاكي دا ناشت أو إيه آدا بس ناش تيها دا لو إيه second hand smoke ده لما لقاني كجو إيشي أبي دا أبسن زندو ده إيشي من إيه أو ييغو بس دا أتانو بس دا أتانو بس دا هاز أنا كو أو إيه كتنه بدي لا إيه يا أساتي بحاز أخلا ملين دا جو شو أو إيه أج أساتي بدهاز أو إيه دي كدو بنينا بدات إهجي arts is yet not ilot arts is a ye yachta hydaf ashot at the ajo just ko and on second hand smoke the finigin the non ahot ya be da hosil ne do de ko diche and the panash do e bahazno ya ka alki wana on the baka breast and cervical cancer program Navajo Cancer Prevention Program Adonal tos el hon baka ado besh behane Adonal tos be ilia da YouTube the cheat na facts the clinic na di koje patients a case je e aja hashin son the social media the clinic jo Facebook Twitter lo ki handlo aj dit hanegi e hashin son na tos da baka adon le de hol jishita lato nakhabik ini nila paya del khen don kinan nishdel ini kito sani dabad na iho on le mebbe moban kanda dilta jo de aja da baka da ho e aja lato e nan e lato hanne e kila e بناهدش أضطر إلى يدخل لكن تناطع أجل كده أدخل كيل جنود أركينا أنا بكاه إيديا بين كيلان سنة ليج تو أشياء كويشنا هو أيجي بناتج أشون كده بنش أني أدو بين سويد أو إكدو هن إجين هيج إشلادو ليج أشياء
Yeah, Miss Rolanda Todecheenie, thank you for your presentation and then also for agreeing to do this 2-day educational series on breast and cervical cancer awareness and most likely prevention. So this is a very informative presentation given by the Navajo Cancer Prevention Program. And also, I would like to give thanks to Mr. Curtis Briscoe for allowing our 2 offices and programs to partner together to create this 2-day educational series. They will be available on the Office of Miss Navajo Nation's Facebook page and then also on YouTube at Miss Navajo Nation. That page will also be featuring the breast cancer and also the cervical cancer presentation. This presentation has been done in Navajo and then also in English as well. So thank you again. It was such an honor to be here and to be a part of this educational series. I have learned something, and my hope is that you all learned something as well in terms of how to be aware of breast cancer and also cervical cancer and how the different ways that we can work towards preventing these different things and what we can do to help ourselves as women and as men, and so that we're able to ensure our bodies are healthy and that we live long, prosperous lives. And so thank you again to Miss Rolanda Todecheenie for coming here and presenting this presentation, and then also to Mr. Curtis Briscoe from the Navajo Cancer Prevention Program. Thank you all for watching, and may you all have a great day.